My name is Zakaria Gashie. I'm a theatre nurse, and here we do different kind of surgeries. We have emergencies, CS, that is a cesarean section. We have craniotomies, different kind of surgeries. My roles are one, to be able to receive the patient from the ward, ensure that preparation has been made, done, the consent has been signed, which is an informed consent from the patient, or if the patient is underage, or those patients mostly who go for major surgeries, maybe a guardian or a relative countersigns for them. So that is one of my roles. Secondly, I receive the patients from the ward, from the nurse. After that, we hold them on the waiting bay, or the waiting beds, where we let them relax, make sure the anxiety has resided from them. After that, when the theaters are ready and we are ready for the patient, we bring the patient into theaters. We have the surgeries that we do perform. You can scrub for the surgeries. Also, you can circulate. For nurses, we have different roles. You can either be a scrub nurse, that is, you are assisting the surgeon during the surgery. You can be the circulating nurse. That's when you are the person who is involved in ensuring the surgery is going smoothly, nothing is amiss, and everything is provided for during the surgery. After that, after we are done with the surgery, and also in the surgery, one key thing that we should all note is safety of the patient, it is more paramount for us, because if there is no safety for the patient, then we are not doing anything. So after that, confirmation that we are doing the right surgery for the right patient, we proceed with the surgery. After the surgery is done, we go to the recovery area, where the patient is recovered until they are fully awake from the anesthesia, and then from there they go back to the ward. Apart from the different surgeons, different specialties who assist us with our patients, we also have different staff members who assist us with the patients also, and I would like to introduce some of them. Highly trained, very competent. On my right, we have Anthony Sande, he's a theatre technician, assists with the anesthetist during intubation and induction of the patient. To my left, we have Margaret, very highly trained, years of experience, theatre nurse, very competent. With the permission of my in-charge, that is Madam Yvonne, I would like to give you a tour of our beautiful and modern theatre. So while we receive the patient from the ward, first of all, they come through this door. We have a barrier there which says do not cross, so there is no moving out or in from that area. But for our patients, we'll come and receive them from here, get on this bed. Before they do that, we'll check for some of the things that we do check. Is the patient, is it the right patient with our bookings? We check for the diagnosis. Is it the right surgery that you're coming to do? Has the patient given an informed consent? And mark the word informed, because that is very crucial. So after we have ensured all that is done, we'll take the vital signs of the patient, that is of the observations. We have the blood pressure, we have the pulse rate, the saturations of the patient, and if it is the mother, that a pregnant woman that we are coming to do maybe a cesarean section, we'll do a Doppler ultrasound, which will assist us in checking the fetal heart of the fetus. When we have received the patient, now we come to this place. This is a waiting area. We'll wait for the patient. The patient will wait for a few minutes for the theater to be ready. So we have the oxygen points just in case of anything, because most of the time we don't have we will not always have a stable patient, so we are ready just in case. After receiving the patient, when we want to go in, first of all, we have 4 theaters in this building, or in the theaters that we have 4 of them, different specialties that can be performed in each and every one of them. So we have the endoscopy, we have laparoscopies that can be done, general surgeries, eye surgeries, we have ear surgeries, obstetric and gynecological surgeries, orthopedic surgeries, and all those, our beds, our state-of-the-art equipment, they are comfortable. We are comfortable to work with them and be able to perform any kind of maneuvers that we want. So for us, for the first theater, so we have our laparoscopic tower, which we use when we are doing different kind of surgeries. So for this, we have set up for bronchoscopy, which we normally do when maybe a person has a foreign body in the airway or the lungs. That's when we do this. We use the bronchoscopy. Other surgeries that we do, we have the laparoscopic myomectomy, we have laparoscopic appendicectomy, laparoscopic, different kind of laparoscopic surgeries. So once the surgeon has seen has already finished with the endoscopes, whatever he has done, if he has taken a biopsy, taken some pictures for clarity and also to show the images to the patient, to be able to have that clear view of whatever the doctor is trying to explain. So we can be able to print whatever the doctor has taken the images and be able to, for the patient can go with them at home. So from theater, that is theater 1. So we're going to theater 2. Before we go to theater 2, mostly we use it for orthopedic cases, and you'll see some of the equipment that we use there, state-of-the-art that we use. Before any procedure as part of infection prevention, we have to scrub up, and scrubbing up we do with soap and water. After that, we come here, we do our gowning. After the gowning, then we go to the theaters. So here in theater 2, we have this theater is equipped for orthopedic cases. As you can see, one of the equipment that we use for orthopedic surgeries is a C-arm. Is one of the supportable X-ray machine. The other equipment that we use is a tourniquet. Tourniquet is used to occlude blood from the extremities when you're doing surgery for, let's say, either upper or lower extremities. It's very useful to assist in blood or bleeding when we are doing the surgeries. So apart from the eye machine, the tourniquet, we have state-of-the-art anesthetic machine. Very beautiful. Does so much for our patient and also for anesthesiologists who assist us in these surgeries. So this is theater 3. Theater 3 is enjoined with theater 4. These 2 theaters are meant for surgeries which can be done with both theaters. One of the surgeries is transplant, that is kidney transplant. We'll have one theater for the donor and the other theater for the recipient. so it has to be enjoined, and this is one of the enjoining part. Being assisted with some of the best equipment, we have the cameras and the lenses. They assist us during the eye and ear surgeries. So once the surgeries are done, for infection prevention purposes, when the surgery is done, all the equipment, all the dirty linens, they don't go out this door, but they go out through this door. And we have a pass box which assists us. All our sets which are we finish with our sets, so to prevent any infections, we put them here. We have a sluice person on the other side, though that is a dirty corridor. So the sluice person, or the person who assists us with taking care of these instruments, they'll pick them from the other side, which will minimize infection. So here we are in theater 4. Theater 4, we do mostly gynecological and obstetric surgeries, maternity, that is pregnant mothers. After delivery, the baby is put on this resuscitator, very warm, being able to take care of the patient, warm the baby. We have the baby cot, which will be used to transport the baby after everything has been done. The first things that we do, that is TEO, the vitamin K, after all that has been given. We have a weighing scale which we use to weigh the baby. We also do the measuring of the head circumference, the length of the baby, checking of the cord and everything. So the first examination of the baby. This is very crucial and very important for the subsequent visits of this baby in the clinics. Once the surgery is done, surgery is over, we come to the recovery room, or the recovery area. Once you will notice something, that the recovery area is very close to the nursing station, where there is close monitoring of these patients until they are fully awake, they are fully ready to go to the ward. We have our crash cart, which is equipped with everything that we require during an emergency situation or emergency that has occurred, including the ambu bag and, most importantly, the defibrillator. Defibrillator is very important during resuscitations in case of a heart attack or arrest. You can be able to revive the patient and take the patient to the ICU for close monitoring. As part of infection prevention theater, the patient moves one way from the entrance, comes to the receiving area, into the wards. After the surgery is done, they come to the recovery area. From the post-anesthetic care area, when they want to go to the ward, they'll move through here back to the ward. So this is where the wards, they pick the patient from. Remember, we had this at the entrance. They do not cross line. Patient goes from there.